I'm Susan Holley. I'm one of the breast radiologists at Wake Radiology. And when I'm in clinic, patients sometimes ask me, should I have a 3D mammogram, or is a 3D mammogram really better than a regular mammogram? Which are great questions, which I'm going to address here. So a standard mammogram is the gold standard for detection of breast cancer at its earliest possible stage. But a 3D mammogram is actually an improved version of this test. So the experience for the patient is actually pretty much the same. The breast is placed in compression and an image is taken. For a standard mammogram, that image takes about a second to acquire, and for a 3D mammogram, it takes 2 to 3 seconds to acquire. For a radiologist, though, a 3D mammogram is a very different study because it allows us to see that breast tissue much more clearly and in much greater detail. And the reason for that is a 2D mammogram takes 2 views of each breast, one view from the top and one view from the side. The tissue that overlaps in either of those views can hide a breast cancer. In a 3D mammogram, images are obtained in an arc over the breast, giving multiple views of the tissue. We can then reconstruct those so that we can look at the tissue in very small increments from top to bottom and side to side. And any tissue that might be overlapping is now visible, and we can find cancers that are hidden on regular 2D mammograms. So a standard mammogram is a very good test. A 3D mammogram is an excellent test. So regardless of a woman's age or breast density, a radiologist can be much more accurate with a 3D mammogram. We can find more cancers, we can find smaller cancers, and we have fewer false positives or fewer times that we call a patient back from screen for something that turns out to be okay. So when patients ask me, should I have a 3D mammogram, my answer is yes. And if you're due for your annual mammogram, I do recommend that you get a 3D mammogram. You can visit wakerad.com to get more information and to schedule your appointment.